Athlete's foot, also known as tinea pedis. Athlete's foot is specifically a fungal infection of the feet, and it is often between the toes, while ringworm can occur in various parts of the body. So, athlete's foot is also known as tinea pedis, which is a specific type of ringworm. Athlete's foot is caused by dermatophytes, a type of fungus that is thrive in warm, moist environment. So athlete's foot is most common between your toes, but it can also affect the top of your feet, the soles of your feet, and your heels. Your skin may become scaly and cracked or develop blisters, and sometimes your feet smell bad. Who is at risk of getting athlete's foot? Everyone is at risk, but it's most common in males and people over the age of 60. So one may be more likely to develop athlete's foot if you have diabetes, obesity, a weakened immune system, tissue damage, or wounds. So we have different types of athlete's foot, and we have 4 of them. Number 1, we have toe web infection, which is the most common type of athlete's foot, and it typically affects the skin between your 4th toe, which is ring toe, and the 5th toe, which is pinky toe. So your skin may change color or crack, peel, or flake. Type 2, we have moccasin type infection A. It's an infection that affects the bottoms of your feet, your heels, and the edges of your feet, and your feet may be sore for a few days. Then the skin on the bottoms of the feet thickens and cracks, and in rare cases your toenail may get infected and they can thicken, break into small pieces, and fall out. Type 3, you have vascular type infection. It typically affects the bottom of your feet, but it may appear anywhere on your feet. And it also has features like bumps or fluid-filled blisters. Type 4, we have ulcerative infection. This one is the rarest type of athlete's foot, and open sores or ulcers often appear between the toes. Now, how do one get athlete's foot? When one lives in a warm climate, have a contact with people or pets that have tinea, and also play contact sports such as wrestling, use of public baths or locker rooms, and have a poor hygiene. When you don't have a good nutrition, when one share towels, clothing, or combs. Let's look at the symptoms of athlete's foot. They represent with itchy, burning rash on the feet, whitening and breakdown of the skin between the toes, scaling of the feet, and blisters of the feet. Now, let's look at the diagnosis. A doctor or a healthcare provider can diagnose athlete's foot by asking about health history and symptoms, and also may do some tests like skin scraping so that the scraped tissue is looked with a microscope. Biopsy is where a small sample from the affected foot will be taken. Skin culture, it's when a sample of skin is sent to lab for diagnosis. Now, prevention. Now, which is the best way to avoid athlete's foot or avoid spreading of the fungus? The first thing you need to do is to let your feet air out by wearing sandals. You need also to wash your feet daily by use of warm, soapy water and rinse and dry thoroughly. Also, one needs to change socks daily, and one needs to protect your feet in public places by wearing waterproof sandals or shoes. Let's look at the treatment of athlete's foot. You can treat athlete's using antifungal creams or antifungal oral medicines such as Clotrimazole cream, terbinafine cream, microscope cream, and oral drug like Ketoconazole tablet, Ketoconazole tablet. Make sure that you have liked this video and also you have subscribed and share.